And the normal human being has 9 to 12 pints of blood. I guess you see how bad the bleeding was. And I had already started shifting away. Like I was feeling I'm losing my consciousness. So I had started to drift. And according to Tirus, because he's more proficient in first aid than I am, he told me I was in the platinum phase. And that's the last stage. So you can begin stuff like organ failure. And yes, and you'll be on your way to heaven if that's your place. So I'll begin personally. I'll begin with lessons learned on that day. As I was catching up on your last lesson, I had Jenga talking about Mr. Tirus talking about a tourniquet. That thing is damn painful. I wouldn't want it on my leg again. I remember telling some of my friends when we were at the hospital to just remove it. I don't care if I get amputated or what, but I told them to remove that tourniquet. It's damn painful, but I think that's what saved my life. Huh? Because Tirus had all the initiative, they first applied the belt. It was an initiative to stop the bleeding because, as you can see from the pictures I had shared on the WhatsApp platform, I was bleeding quite a lot. So they used a belt on me, on the femur, yeah, to stop the bleeding. And tourniquets are very damn painful, but you should have the initiative to improvise one, put it on the person, and whether or not he cries or not, screams, don't remove that tourniquet. If you're not sure about it, you'd rather let it stay there. The second thing that I learned most is always carry a first aid kit. I remember when Bonajenga came around to save me, they gave me some ibuprofen, and that medicine, that painkiller saved me quite a lot of trouble, saved me quite a lot of pain. And it is true. If I had carried a first aid kit, and maybe Tyrus didn't have it, he could have used my own medicine. If I had carried a first aid kit on the motorbike, I could have a tourniquet. But unfortunately, that was not the case, although it was so bad on my side. Although there's something I noted also about Tyrus, he was very authoritative and coordinating people. I remember in the first instance after the crash, I was begging people to help me. I was pleading with them because I've been training on some first aid issues. So I have the basics of first aid. So I was pleading with people to put some tourniquet on to stop the bleeding. But unfortunately, since they did not have the know-how, they were just looking at me. And it reached a point, as I told you, when I started drifting, I just closed my eyes and I was ready. And I was ready for whatever will happen. Fortunately, Mr. Jenga was on the way coming. Although you should teach people, always teach people. Yes, you might be an expert about first aid, but picture yourself. For example, I would consider myself adept in first aid, but in this circumstance, I was the one who needed help. So, Mr. Jenga, congratulations and your team because of this initiative. It's the experts. Imagine yourself, you as the expert for the first aid, you're not in a position to help yourself out. Who will help you? So you really need that. You really need that life skill yourself and teach others, especially maybe in the family setting. For example, you're at home and you just start. Maybe your mother doesn't know how to do first aid. Your wife doesn't know how to do first aid. So yes, you'll die with the skill, if I'm allowed to say that. And always, always, always practice. Practice all those drills, everything that you know about first aid. Don't take it for granted. Always practice it because let it be next to muscle memory. Because on the D-Day, it's hell, and everybody is shouting, people are not coordinating, other people just want to take pictures. I don't know what they do with them, but it's quite hectic. So it's on that D-Day when things go south. It's only your muscle memory will be the one to save you. So and you'll just have it when you repeat it day in, day out. Whenever you have an opportunity to practice the skill, just do it. It will save you one day. So yeah, precisely, I don't want to take much of your time, but I think that's the basic thing. And I'd like to take this opportunity again to thank Mr. Tirus and his team. Thank you for saving my life. And thank you for this initiative. You know, it's quite something. So we'll be saving people. I'm a little bit, not a little bit, I'm very encouraged to be in this team. As I sent in the WhatsApp platform, you can now see me walking. Yes, I'm happy. I have one crash, yeah, but it's been a long road. It's been a long road home, and I'm glad I have my legs. And once again, thank you. Something else I learned is fitness. Fitness is of great importance because well, maybe I had the right foot injury, and some of the activities you should do after your heart. Maybe, for example, when you're visiting the washrooms and you have to do one leg squat, it's quite hectic if you are not fit at that type. So fitness is something cool if you manage to keep up with. So I think I'll not spend more of your time. Basically, that's what happened, and I'm a survivor. Thank you.
Silas.
Yes, sir.
Yeah, do you have anything to say in regard to that? What did you do?
Oh, okay. It's like I said before, it's just doing the basics and doing them right. So Mr. Wanyoike has hit the nail on the head, and he said you don't have to be an expert to do these basic things. It's just applying a tourniquet, making sure if you see bleeding is coming. We had this lesson last week of the big C. So the big C will kill you. If the big C is not going to kill you, no area where you're going to talk about today is going to kill you. So all these things is like they go with that like a hierarchy. So you start with the big C, you stop the bleeding, then you go to airway. The way you are structuring these lessons, and it's just doing the basics. And everyone and anyone can be left or they can be found in that position where you are actually responsible of somebody's life. It doesn't have to be a stranger. It could be your mom. It could be your relative. It could be your loved ones. Because again, we have vehicles and we drive as families. We drive as friends. And an accident could happen, and you can find yourself. You could find yourself being the one saving the person that you love most in that car. So when you're going through these lessons, let's not just do them as emotion. Let's not just do them because we think, oh, people from America, people from UK, or people from wherever they are teaching them. Let's do them because we know and we actually feel it, and we know what they can actually do. And if we have that attitude and mentality, I think we'll go a long way. Yeah, that's all I have for now.
Okay, thank you so much, Mr. Silas, and thank you for saving Mr. Wanyoike's life. Yeah, so me too, I have a story, but is for another day. Yeah, this happened to me last year, and I encountered almost the same scenario like you. So, but I will use my team on the ground down there, and to hunt down the guy that we helped on the road, and he was in a very critical condition, and we had to do what we did, the first aid that we know, and the guy is living. So he will come here too one day and give the side of his story too. So whatever we are doing, as Tyler said, and is if you take it seriously, it can save life, and it saves lives. So thank you. So I don't want to keep you guys here for so long too. Yeah, but I like acknowledging a few people. Yeah, so I have Mr. Justin Roberts. Say hi.
Hello, everybody.
Okay.
Hi, Justin.
Yeah, he's the guy who gave the last week's class. So, and then I have Mr. James Bailey. Bailey, okay.
Hello, everybody.
We can't see you.
How about now?
Let me see.
That's better.
Yeah, that's better. You have been missing in action.
I have. I'm a busy man, but I'm here for this event, and I'm happy to be here. Good to see everybody.
Outstanding. Thank you so much. If you guys can remember, that was our first instructor. He's the guy who opened this session. All right. Thank you, Mr. James Bailey. The next one gonna be Mr. Sean Vok.
Hey, how's it going?
You're doing fast.
Good.
Training, yeah, so we have a go for it.
You good?
Yeah, brother.
Outstanding. Thank you so much.
Happy to be here.
All right. Thank you so much. Then, yeah, everybody knows Tirus. And then today I'm going to introduce my sister, if she can hear me, Jane Chege. She's, as I promised you, we're going to be tackling a lot of subjects moving forward. And she's the person that I'm targeting in the area of mental health, because, you know, worldwide, we are facing mental health and suicide. So she's a medical doctor. She's a consultant in that area. So one of these days, she'll be coming online to talk about mental health. So Dr. Jane Chege.
Hi, everybody. How are you? I'm Jane Chege. I'm Jake's eldest sister. And I'm a consultant psychiatrist based in the UK. So glad to see you all. And sorry I missed the first 2 sessions, but I'll try my best and be available for the future sessions.
So what do you have to say about mental health?
Good to see you, yes.
What do you have to say about mental health?
Well, it's as important as physical health, that's for sure. So you can't be healthy without, you know, having, you can't have, you know, a healthy, or for you to have a good, healthy well-being, you need to be healthy both as far as your mental health is concerned and your physical health. So they go hand in hand.
Outstanding. Yeah, so thank you so much for your time, and we hope to be seeing you down the lane in one of the lectures.
Yeah, I'll be there. Yeah.
Thank you so much.
Thank you. Bye.
Okay, bye. All right. Okay, now guys, let's go to our today's lecture. Today's lecture is about airway management. So let me share the slide to this one. Okay, give me a minute. All right, everybody can see that?
Yeah.
Outstanding. So those are the ground rules for today. Please mute yourselves and just unmute yourself when you're about to talk. So at least we minimize the background noise. So today I'll be the guy who'll be lecturing today. At least I wanted to do something. I haven't done something for the last 4 weeks. Anyway, so that's first aid lesson, airway management. My name is Jake Chege. I'm based in Saudi Arabia. So all those guys I introduced, I work with them. They are here with me. They are all from American descent. So they are the guys who are very happy to help us in this course. So you'll be seeing, you have seen some of them in the previous lectures, and you'll be seeing them in the coming slides and even more. We are whole team here. We are all dedicated to you. And Tyler's will be bringing his team too from the other side of the UK. All right, so today we're gonna be talking about airway management. And as you know, we tackle it using the ABC, and the ABC of airway means airway, breathing, and circulation. So today we are just tackling the airway and the breathing and circulation. Breathing will be the second week, next week. And then circulation gonna be the other week after that with different instructors. All right. So airway emergencies. So okay, airway emergencies. The airway is the passage through which the air moves from the nose and mouth to the lungs. If anything blocks the airway, the person chokes and cannot get enough oxygen, and life is threatened. This is an emergency, and you must give aid to clear the airway. So the meeting is being recorded too, so you also can record from your side, so at least you can have some references. Okay, so this is the anatomy of our airway. So we start from the tongue, and we know for those guys that are in the medical field, we know tongue is our #1 obstacle when it comes to the mouth. So that's why they say before you do anything else, if you suspect somebody is not breathing, the first thing you can do to open their airway is just maybe tilt their head. Because once somebody especially goes unconscious, we know the tongue is a very soft tissue, and what it does, it just falls back and blocks that airway. So that's why the first thing to do is to tilt that head. It's called, we're gonna find it in the incoming slides. Is called we can use the two methods to open the airway. One is head tilt, chin lift, and the other one gonna be, what is it called? Is jaw thrust, sorry. Yeah, the other one is jaw thrust, and we're gonna tackle them in the upcoming slides. All right, so next, so you see the esophagus, vocal cord, which is vocal fold, epiglottis, and the soft palate. So airway causes of airway obstruction. So an airway obstruction can occur if the tongue or swollen tissues of the mouth block the airway caused by an injury to the mouth, a severe allergic reaction, and the tongue dropping to the back of the throat and block the airway. As I said, it relaxes and it blocks that airway. So what you can do, the easiest way you just head tilt, chin lift maneuver. Okay, so let me see if it's being recorded. Yes, it's being recorded. Yeah, okay. So next, airway blockage caused by a foreign object or fluid is called choking. So in this area, we're gonna be doing a lot of choking because, as we said, we're gonna start from the houses. We're gonna start from our houses, then we come all the way up. So we're gonna be talking about a lot of choking because that's one way. We are trying to make it as simple as possible, but as we progress, we'll be doing a lot of deep diving into these slides. So airway blockage caused by a foreign object or fluid is called choking. And then what are the causes of choking in our households or in our daily lives? So it's trying to swallow large pieces of food, excess alcohol, causing suppression of the gag reflex, and then choking on food. Dentures for the old people, it can cause choking. Eating with talking excitedly or laughing or eating too quickly, or walking, playing or with food, small toys or other objects in the mouth. I think that is self-explanatory. I have tried to use as simple language as possible. A person, signs and symptoms of choking is a person who is choking may have a partial or complete blockage of the airway, and a complete blockage will not allow breathing. A partial blockage may be cleared by the person coughing. So if you see somebody who is trying to cough, don't stop them. So just encourage them to cough. So signs and symptoms of partial obstruction is high-pitched or wheezing sounds when breathing in coughing. High-pitched or wheezing sounds when breathing in. Yeah, you hear that like snoring sound. because at least the airway is not going down the lungs correctly. And then definitely there'll be coughing or clutching at the throat with one or both hands. This is a universal. This is a universal sign. So if you see somebody holding their neck, yeah, that's a sign that they are choking, because most of the time they might not be even be able to talk. So holding their neck using their hands is a universal sign. So even if you do it, somebody who is closer to you, and they can just realize what is going on with you. So signs and symptoms of complete obstruction may be conscious or unconscious. So sometimes when somebody is choked, they might fall conscious or unconscious. So they might be unable to breathe. That's why you need to check their breathing too. So let me see, please ask the host to give you permission to record. So unable to speak, unable to cough, face may appear bluish. For those guys who have a little bit knowledge in medical, if their face turns bluish, we call it cyanosis. Yeah, that's the medical term used when somebody starts to turn blue. It's called cyanosis. So continuation of signs and symptoms of complete obstruction is a conscious adult can usually indicate they are choking by using the universal method or sign or signal of clutching their neck by using either one hand or two hands. But with an infant or small child who is conscious but not able to breathe, assume they are choking on something. So first aid. Now, this is what you are supposed to do for somebody who has airway blockage or somebody who is choking. Okay. Sorry, what's Janet saying? Yeah, somebody is asking questions here. Okay. Tirus and Gideon, can you see, guys? Can you see the questions people are posting?
Yes, Jakes.
Okay, yeah, just attend to the questions people are raising up there. Yeah, some people need some help.
Sure.
All right, let's continue with the first aid. What we are supposed to do when somebody is choking or they have a blocked airway. For a patient with a partial airway obstruction, do not interfere with the attempts to cough up the object. So if you see somebody coughing, just encourage them to continue coughing. So if the patient is no longer able to cough or speak, treat as for complete obstruction. And then what do we do when somebody has a complete obstruction? This is in the next slide. So first aid for a conscious choking adult with complete airway obstruction. So first is to ask, are you choking? Summon someone to help you. If you don't know how to do it, then you can summon some help. Or if you know how to do it, you can tell the other person, especially if the person you are helping falls unconscious, you can tell the other person to call. In Kenya is 999 or whatever number they can call for the ambulance, because some people, they might even go unconscious. So that means you have to transport them to the next echelon of care. So that's why you need to summon someone, especially most of the things that I've seen somebody who choked and they even needed CPR then later. So at that point, that the other person you have summoned, you can give them instructions. Hey, call 999, or hey, call the ambulance number if you have it. Yes. So it's always good to alert somebody else, so at least somebody else can be tracking what you are doing. Attempt abdominal thrusts. You guys remember, or you know that abdominal thrusts, they have another name. They are called Hemrick maneuver in the medical world. But because Hemrick is a guy, so that's why it was changed to abdominal thrust because of loyalties. If you have to use somebody's name, you have to pay them, right? So that's why it was changed a little bit to abdominal thrusts, but it used to be a Heimlich maneuver. Okay, attempt abdominal thrusts. Start behind the person and wrap your arms around the waist. Make a fist with one hand and place the thumb side of the fist on the middle of the abdomen, slightly above the navel. We'll be seeing a video later on. We'll see a video how it is done, the abdominal thrusts. Arias Heimlich maneuver. Yeah, so first aid for a conscious. So for a conscious choking adult with complete airway obstruction, you can see they're doing the universal sign. They're clutching their neck with both of their hands. And then you can see where the lady or the paramedic or the medic, EMT, first responder, nurse, where they are putting their hands is right above the navel. And you make like a fist. So you grasp your fist with the other hand and give quick upward thrusts into the abdomen to dislodge the objects. Repeat until the choking stops or they become unconscious. We're gonna see, that's why they repeat until the choking stops or they become unconscious. We're gonna see what we do when they become unconscious. So this still abdominal thrust for conscious choking adult with complete airway obstruction. Use chest thrusts when you can't reach far enough around the patient, or for women in late pregnancy. If somebody is big, or if somebody is expectant, use chest thrusts to the work, just as Heimlich maneuver or abdominal thrusts. Place your arms under the patient's armpits and around the chest. Make a fist with one hand. Press the thumb side against the center of the patient's breastbone. We'll see this one. And that's why I'm not exhausting a lot on them, because we're gonna see it in a video here shortly. Yeah, so abdominal thrust for a conscious choking adult with complete airway obstruction. Continuation, this is not to be the lower tip of the breastbone and not on the ribs. So we don't do it on the breastbone and we don't do it on the ribs, because we can bruise the ribs, and we can also, there is capability or susceptibility that we can break the ribs. That's why we don't do it on the ribs. So when you're doing it on the chest, make sure you are on the chest bone, not on the breastbone or on the ribs. Grab your fist with the other hand and thrust inward. So repeat until the object is dislodged or the patient becomes unconscious. So when to stop chest thrusts or abdominal thrust and back blows. Yeah, we give back blows to small kids. Also, it's coming in the next slides, but that's why it is there. So don't be confused by back blows. Back blows is for little kids and especially the infants. So stop immediately if the object is dislodged or if the patient begins to breathe or cough. Make sure the object comes out. The thrust can cause internal injuries and should be seen by the next echelon of care. So take them to the clinic, take them to the nearest hospital. At least they need to be checked by somebody else other than you. Yeah, so that's why the thrust can cause internal injuries, and should be seen by the next echelon of care. So first aid for conscious choking children. Now we have transitioned to children, this with complete airway blockage. You can have a complete airway blockage, obstruction, or you can have a partial. So the significant difference for treating a child over the age of 1 is use less force to expel the objects. Yeah, we all know that for infants or for kids less than 1, the anatomy is not fully formed. So that's why they are telling you to go easy on those people or those kids So because you don't want to cause, in medical, there is a saying that you don't want to cause more harm to the patient than they're already experiencing. So that's why they're telling you you should use less force, yeah, compared to that you can use for an adult human being. Make sure you are sitting or stable before starting. Yes, because you don't want to cause more harm to the patient. You don't want to start doing an intervention and then all of a sudden you are maybe falling onto your patient. So make sure you are seated, or you are stable, or you are standing well. You have a good gait. Otherwise, use the same method as an adult. So the exact one we said, that is called the Heimlich maneuver, or abdominal thrusts. All right, so first aid for conscious choking infants with complete airway obstruction. First, determine if the infant is choking by observing if the infant can breathe, cough or cry, or is coughing weakly or making high-pitched sounds. Yes, for those guys who have experienced this, or you have somebody who have experienced airway blockage, they usually produce a very high-pitched sound, yeah, because there's no room, so whatever the air can come out. That's why they have that high-pitched sound, and they might be coughing or crying. Yeah, do not use abdominal thrusts for infants. You cannot even be able to hold them to do the abdominal thrusts. Yeah, so, and for infants, you know, the head is usually, his cord is heavier, he's a little bit heavier than the rest of the body. So if you try to do a Heimlich maneuver on a kid, not only you're gonna injure them, but their head will be locking forward. Yeah, because they are not able to withstand the gait, or their skeletal muscles are not yet that strong enough to support them for a Heimlich maneuver or abdominal thrust. Yeah, so okay, infant's continuation. Turn the infant upside down, or no, so not upside down, face down on your forearm with the head lower than the body. And with the heel of your hand, give 5 forceful back blows between the infant's shoulder blades. So we are trying to put them at an angle with the arm head lower than the body. So at least, to use gravity to our advantage. Yeah, so we are using gravity to our advantage. So when you're giving them those little blows between their shoulder blades, and then using gravity, that helps whatever is launched in their mouth to be spit out. So that's why we have to lower them a little bit. And when you are hitting between the shoulder blades, you just need to be forceful, but not like you are hitting an adult. Also, be mindful of that. So be cognizant of that. Don't hit so hard. Just enough force to unlaunch whatever is launched behind their or inside their mouth. Then turn the infant over with its head lower than the body. So we are just doing this to make sure we are using gravity to our advantage. Then after 5 blows, you turn the infant and you look. If you can see it, you can try to dislodge it. But I think it's in the next slide that says we don't do what they call the bright sweeps no more. Yeah, but you're gonna see it in the next slide. So yeah, conscious, give 5 chest thrusts using your middle and index fingers on the breastbone, 1 finger width below the nipple line. So it's almost like you're doing a CPR. But it's almost like a CPR. If you do CPR and you're doing these chest thrusts, they almost look the same because you're just using your 2 fingers. Just the same we do the CPR for infants. So it's almost the same thing. Yeah, so repeat back blows. If the object doesn't get dislodged, just repeat. Repeat the process. Then turn the baby head lower than the body. Sorry, 5 blows between the shoulder blades, turn, check, then chest thrusts using your finger. Index and middle finger. Yeah, we'll see it in a video. So continuation also, if the obstruction cannot be removed, the casualty may become unconscious. So if they can't breathe for some times, or if the object lodged in their mouth doesn't come for some time, then the circulation, or is it the circulation? No, it's not circulation. The respirations will be cut, or the oxygen will be cut, and then they can become unconscious. So lower the casualty to the floor on their back, open the airway and look for an obstruction. If seen, lift the lower jaw. Remove the object by sweeping it out using a hooking action with your finger. But if you can see it, the key word there is if seen. So if you don't see it, don't try to put your fingers inside there. Where we don't do bright sweeps no more. Because what you do, if you can't see it and you poke your fingers in there, whatever is dislodged there, you can push it even further down. So no bright sweeps. So the key word in that sentence is if seen. Yes. Be careful not to push object deeper, obviously. So that's how. Next, try to open the airway using head tilt, chin lift maneuver or method. So that's how you do. So you place the finger or your fingers beneath the chin and the other hand over the face, and then you tilt that head. So that's the first step you do when you suspect somebody has a blocked airway, or they have the airway has been compromised. That's the easiest way you can do it. So, and then in the coming classes, we're gonna go deeper than how you can even open it, because now we have what we call airway adjuncts. Yeah, so if you try head to chin lift maneuver or method that doesn't work, then I don't know if the EMTs, paramedics, nurses, first responders in Kenya use what we call OPAs, oropharyngeal adjunct. Yeah, so that's something we put in the mouth to keep it open. But that one, the disadvantage with that is it has a gagging reflex. So it can make you vomit. That's what it means by gagging reflex. So if somebody, if you put that thing in, the OPA, if somebody has a gagging reflex, then you're supposed to remove it. Then we advance from OPA, then we go to your nose. We put something we call NPA. NPA is nasopharyngeal airway adjunct. And then that one works. If that doesn't work, then we can put what we call iGel, or in other hospitals or in other areas, in other countries, they can put what they call King LT. If that then doesn't work, then we go to the crike where we do the surgical. We cut your neck and then we insert the crike kit, and then the catheter there, and so you can breathe through it. Then if that doesn't work, then you see a lot of doctors, then they can do the chest tube and that thing. So that's how it progresses from very simple maneuver of head tilt, chin lift, all the way to surgery. And all of them, they are easy to do, pretty easy to do, but you need a little bit of skill and experience. Yeah, so continuation. So assess for effective breathing for 10 seconds. If not breathing, attempt to ventilate. So ventilate, the easiest way you can ventilate a person is mouth to mouth. So you can do mouth to mouth. That's the easiest way, because that's available to everybody, because everybody has a mouth. And then for those people that they carry stuff in their purses on their first aid kits, we have what we call a mask, a little barrier where when you're giving mouth to mouth, you just put this mask on somebody's mouth, and then you can put your mouth on it, because a lot of people out there, they don't want to share saliva, or not everybody that wants everybody else to put their mouth on their mouth. So that's why there is that sheath of polythene mask you can put on somebody's mouth, and then you can give them mouth to mouth. Yeah, so if air does not go into the lungs, tilt the head and try again. So you open again using the head tilt chin lift. If air does not go into the lungs, assume the airway is still obstructed, and begin the CPR sequence with 30 chest compressions. Yeah, so this one we're gonna be next week, but they're gonna tell you next week how we do CPR is 30 chest compressions with 2 rescue breaths. So 30, you count 30, which are rate of 100 beats per minute, and then 2 rescue breaths. Then go back to 30 compressions. You do that until either the object is dislodged or the next level of care comes and relieves you. Yes, so after those, open the airway and look in the mouth. So we are looking to see if we can see the object. So again, if you see an object, remove it. If you cannot get into air, if you cannot get air into the casualty's lungs, continue the CPR sequence, always looking in the mouth before the ventilation attempt. Keep trying to clear the airway. So once you start CPR, we know there's a golden rule in the medical field that once you start the CPR, you cannot stop. So once you start it, you cannot stop. So yeah, you'll be you're just going to be continuing that sequence. So CPR, 30 compressions, 2 rescue breaths. Before you give the 2 rescue breaths, you have to look in the mouth to see if you see the object. If you don't see it, you continue, then 30 compressions at a rate of 100 beats per minute, check, 2 rescue breaths, and that's forth until somebody comes on scene and relieves you. If you see and change, if you see and change in person's condition, stop CPR and reassess the ABCs. So if any change, if the person maybe is better now, he can breathe. You see maybe the bluish cyanosis has subsidized, or it has improved, or the item has been dislodged, then you can stop your CPR and assess the ABCs, which are airway, breathing, and circulation. So yeah, next, once you can breathe air into the casualty's lungs, give 2 rescue breaths. Yes, so as I have been saying. So then complete the primary survey by checking casualty for signs of circulation, and checking and caring for severe bleeding. So for circulation, we check for pulses. I think that's the minimum you can do on the scene. Yeah, you can check for pulses. You can start with radio pulse or carotid by the neck. Radio is by radius, by the you have big thumb, and then you can go for carotid at the neck. Please mute yourselves. Okay, so check for radio pulse, that's circulation, and checking and caring for severe bleeding. Severe bleeding, if you had not taken care of it at the first, because it's supposed to be taken care of first. You know, last week you heard that somebody can die very easily from severe bleeding. So severe bleeding should be taken care of even before you come to airway. Yes, somebody can survive a little more minutes when they're not breathing, or more than when somebody is breathing profusely. Severe breathing will kill you in minutes. Yeah, if you read something in medical, you know that you can die in about 3 minutes if you have arterial bleeding and it is not being stopped immediately. You can die in 3 minutes, if not less, and you lose a lot of blood. Is there no signs of saturation? Begin CPR. Yeah, one golden rule of starting a CPR is if somebody doesn't have a pulse. If somebody doesn't have a pulse, they are not breathing, then you do CPR. But if somebody has a pulse and it is weak, that's when in circulation we give fluids, we give IV, we do IV. We give, in the next classes to come, you're gonna know all about how we give normal saline, lactate and lingers, whole blood, platelets, RBCs, red blood cells, and so forth. So, but that's for another class, but that's how we do. If somebody has weak pulse, we give fluids. If they don't have no pulse and they're not breathing, we do CPR. All right, so if the casualty has signs of saturation but not breathing on their own, continue rescue breathing. Yeah, definitely. If you have no oxygen, then you'll have to be giving them that mouth to mouth. If that's the one you can afford on the ground or on the scene, you have to continue to give them rescue breathing, mouth to mouth. Then if you have, you guys who have vehicles, if you have a first aid kit, you know the first aid kit, some of them comes what we call BVM. So a bag valve mask, BVM. So you can use BVM and you can be bagging that patient. And then when the next guy with the ambulance comes, the paramedics, they get to the hospital, there they can be hooked to the oxygen. But you on the ground, the most I see you doing is mouth to mouth. And so we have to do what we have to do to save lives, man. So if the casualty starts breathing on their own, monitor the breathing and saturation. Maintain an open airway and get to the next level of care. So how do you monitor breathing? Breathing can be monitored by by doing 3 things, very simple ones. You just look, listen, and feel. Yeah, so what you do, you just tilt your head, you tilt your head, you put your head into the, beside their mouth. By that time you are looking, look, listen, and feel. So we are looking for the equalize and fall of the chest. And then we are listening, look, listen, and feel. So we are listening for those air escaping from their nose or from their mouth. So you'll feel that this guy is breathing. And then we listen for any sounds. Yeah, if somebody, you know, there's that little sound, very still sound that somebody gives when they're breathing. So that's what we do. We look, listen, and feel. So if somebody is, all those are positive, all those are green to go, then that guy is good. That's how we monitor for breathing. For circulation, as I told you, you look for pulse. And then also you can, they usually do to some kids, they pinch or they pinching your thumbnails. You can be able to tell the circulation. Yeah, so if you pinch your nails and you see like they get filled with blood, then you have a good circulation. Yes, you have good perfusion. That's what they call it, perfusion. Yeah, so and circulation, maintain an open airway and get to the next echelon of care. So if you had used any mechanism to open that airway, if you had used the OPA or pharyngeal airway, adjunct, you had used the NPA, you had used anything, whatever you had used to open that mouth, if in case of you keeping that mouth open by using anything, so just maintain it that way and just transport that guy. Put the casualty into the recovery position. What is the recovery position? Recovery position is the position that is fit, comfortable to the patient. This is mostly dictated. It is most dictated by the patient himself or herself. If they tell you, hey man, if I'm sitting, I'm breathing better and I'm feeling better, then let them sit up. If there's leaning forward, if they tell you, hey, when I lean forward, I feel better and I can breathe and maintain my own airway, you have to put them in that leaning forward position. So recovery position mostly will be dictated by the patient if they are conscious, because now unconscious patients, they don't talk. Yeah, so for unconscious patients, what we do, we tilt them to the side. Why do we tilt them to the side? So that in case of they have any vomiters, so if they vomit, they spit, that thing can just drain itself instead of me being there with my sanctioning the vomiters out of their mouth. So that's why we put them a little bit, we tilt them a little bit on the side to make sure that whatever is coming out of their mouth and they're unconscious is just draining itself. So yeah, that's the difference. So first aid for an unconscious choking adult. Open the airway and place your ear close to the person's mouth. Then look, listen and feel, just as I said like a few minutes ago, for signs of breathing for 10 seconds. So look at the chest and abdomen movement, listen for the breathing sounds, and feel for exhaled breath on your cheek. If none of these signs are present, the casualty is not breathing. Sorry, so then use the head tilt chin lift maneuver or method to open the airway. Attempt to ventilate mouth to mouth or whatever you have, BVM and so forth. If air doesn't go into the lungs, retilt the head and try again using the head tilt chin lift method. If air still does not go into the lungs, assume the airway is still obstructed and begin the CPR sequence with 30 chest compressions at a rate of 100 beats per minute, followed by 2 rescue breaths. After those, open the airway and look in the mouth. If you see an object, remove it. Into parentheses, no blind sweeps. So we don't do that thing. So because if you don't see it and you poke your fingers inside there, as I said earlier, whatever is inside there, you just push it even further down. And so we don't want that. If you cannot get air into the casualty's lungs, continue the CPR sequence, or always looking in the mouth before the ventilation attempt. Keep trying to clear the airway. If you see and change in the person's condition, I think that should be, if you see any change in the person's condition, stop CPR and reassess the ABCs. Once you can breathe air into the casualty's lungs, give 2 rescue breaths, then complete the primary survey by checking casualties for signs of circulation and checking and caring for severe bleeding. If there are no signs of circulation, begin CPR. And first aid for unconscious choking child or infant. First aid for a child under 8 is the same as an adult with 30 compressions, but only performed with 1 hand. So nothing changes. The only thing that changes is we just use 1 hand. But for an adult, you guys who have done CPR, you know we use 2 hands. First aid for an infant is the same, but with 2 fingers. Then for the infants, yeah, so adult we use 2 hands. For a child 8 and under, we use 1 hand. And for infants, those are less than 1 year, we use 2 fingers on their chest bone. These are the choking emergencies, casualty conscious, so choking, coughing forcefully, encourage casualty, and then their care is encourage casualty to continue coughing. Partial obstruction can speak and breathe. You can feel that wheezing sound, so continue coughing. If coughing persists, call your call the 999 country dependent. For us, we call 911. In Kenya, you call 999, or the other numbers you call for the ambulance. So casualty is conscious, coughing weakly, so you get some help. Complete obstruction, cannot speak or breathe. Begin abdominal thrusts. If for a child, it's going to be back blows and chest thrusts for infants. And then casualty unconscious. So the sign is going to be no breathing, and call the next echelon of care. So complete obstruction, breaths won't go in. So begin CPR. Look in casualty's mouth for an obstruction after each cycle of compressions before attempting to ventilate. And then here I have a cool video. Let me see if this is gonna cover from everything we have covered. It's just like a summary of the choking, and it's gonna cover for adults and for kids and infants. So let me see if it's gonna play. So let me stop share that one, and I come to share the video. No. Give me a minute here. I opened that video. Okay, I have it. Share the video. So everybody can see that? Yes?
Yes.
Yes.
Okay, so let's listen to it.
Hi, my name is Suzanne Mortel, Life Support Instructor for Marshfield Clinic. Choking is a life-threatening situation that can happen when a person's airway suddenly becomes blocked and they cannot breathe normally. Choking can happen when people eat or drink too quickly or place foreign objects in their mouths. The risk of choking increases with not chewing food properly, with alcohol intoxication, or with an abnormal swallow reflex. Determine if the person is choking. Knowing how to help somebody in a choking emergency can save a life. There are 3 techniques that you should know during a choking emergency. For adults and children, you should use abdominal thrusts, and for infants, back blows and chest thrusts. If the choking person can cough, you want to encourage that person to keep coughing. However, if the person is unable to breathe, cough, speak, or cry, you're going to want to act immediately. Tell someone to call 911, and then let them know that you are going to be helping them relieve the obstruction. If an adult or child older than 1 year is choking, perform abdominal thrusts, also known as the Heimlich maneuver. First, stand or kneel behind the person who is choking. With one hand, make a fist and place it above the belly button. The second hand, lay over the fist. You're going to do quick upward thrusts to try to remove the object. Continue to provide abdominal thrusts or chest thrusts until the object has been removed or until the choking person can no longer stand. At that point, assist that person to the floor and provide CPR by pushing hard and fast on the chest until help arrives. If a child younger than 1 year is choking, alternate back blows and chest thrusts. Position the infant over your forearm and deliver 5 back blows between the infant's shoulder blades. Roll the infant onto your other forearm, supporting his head and neck, and give 5 chest thrusts. Continue to provide back blows and chest thrusts until the infant stops choking or is not breathing. If the infant is not breathing, lay the infant on a hard surface and start CPR by pushing hard and fast on the infant's chest until help arrives. You can perform abdominal thrusts on yourself if no one is around. If you are home alone and begin choking, you can perform abdominal thrusts on yourself. First, dial 911 even if you can't speak. Then, place your fist in your hand above your belly button, find a hard surface such as a countertop or the back of a chair, and give yourself abdominal thrusts.
All right, so let me go back to the slide. Share. Okay. So that's how we do for the head tilt chin lift. So is the easiest.
This short video will give you important information about how to respond when a child needs CPR and when a child is choking. Anyone taking care of children should learn these skills. Learning them could help you.
Sorry about that. So that's the head tilt chin lift. This can be used to stop the tongue from blocking the airway. If the airway is blocked by swollen tissue, this may not work. If air goes in from rescue blades, the airway is clear. Also, there is a way that we say if somebody is talking to you, then that means that their airway is patent or is clear. So you can, before you even go to open their airway or to tilt their head, if that guy is talking to you, that means their airway is clear, so at least they can breathe. So, but it's a very easy maneuver to do. You just tilt their head backwards and you open that airway. So that's how to do it. Yeah, so, and then we go to our last slide. So do I have anybody with a question? Or a contribution?
I have a question.
Okay.
So people like they say if coughing is the best way for CPR. Is coughing the best way to remove out the object or a food
If you are okay, thank you for that question. So if somebody is coughing, you can just encourage them to cough, continue coughing. You should not stop to tell them, you should not stop them to cough. But what you can do as the third party, you can just come and expedite the process by doing the abdominal thrusts. But because coughing can take long, I have seen somebody who was choking and they could not even get that thing out of it because it was a huge piece of meat. Yeah, so no matter how much they could have coughed, that piece of meat was not coming out. So, and abdominal thrust did the job. But in some cases, if they cough, it can lodge the item or whatever is lodged there. But yes, if they're coughing, encourage them to do it. But it's one way. It's not the best, but it's one of the ways. Okay.
Okay, thank you for that. I'm also learning CPR also.
You're learning CPR?
I'm 11 years old.
Oh, okay. Thank you for coming here. Next week gonna be a whole class of CPR, so don't miss next week.
Okay.
Okay. Yeah. So, do I have any other question or contribution?
Bona Jake.
Okay.
It's Wanyoike here.
Okay.
I have a contribution to make.
Okay.
Last time I caught your class late about the tourniquet and stuff, you know.
Mm-hmm.
And people were asking a lot about the tourniquet. It's not something technical.
Uh-huh.
You can just, I made something very easy here. I don't know whether you can see it. This is just a cloth. You can have a strip of cloth, okay? I want to demonstrate to them. You can just have a strip of cloth and maybe a piece of wood or anything that is strong enough. And you tie it around there, okay? And maybe if it's for the limb, sorry for that, maybe if it is the limb which is hurt, you can just put this into the limb, okay? And then, for example, these are arm, and when you put it in here, you start coiling it. You will coil it until you're sure that it's tight enough and bleeding will stop. Okay, that's my only contribution for today. Thank you.
Thank you for that, Bona Wanyoike. So for the next class, I'll bring a professional tourniquet. Yeah, so I'll put a note somewhere. I'll bring a professional tourniquet, and I'll try to see if I can get one of my colleagues for a demonstration. So at least now you can see the real tourniquet, how it looks like and how it is done and how effective it is. So next time, remind me before we start the class, we need to do that little demo somewhere. Yeah, so I'm gonna bring a professional tourniquet. I'm gonna bring like 3 of them because we have like 3 or 4 types. So I'm gonna bring like 3 types. But as Wanyoike is saying, you can improvise because even tourniquets are available in Kenya, I know for sure, but they are expensive. But as Wanyoike is saying, you can improvise anything as long as it's not very thin, because if you use like a wire, it will cut somebody and it will dig into the muscle, into the meat. So you just look a very sizable breadth of the material you are using, and then you just tie it, and just as he was saying, just twist it until it cuts the breath, the breathing. It is you check for 2 things when you are using a tourniquet. If the breathing stops, that's one. You twist that thing, whatever you are using. If it's a belt, anything, lasso, as Tirus was saying last week, you twist it until 2 things happens. Breathing stops and there's no pause. Yeah, so if you check, if it's on the arm, you check that radio pause, there's no pause, and there's no breathing, then your tourniquet is effective. If it's not, and if you put on tourniquet high and tight, and still the breathing continues, then you need to put another one, because you cannot remove the other one. You have to put another one until bleeding stops and there's no pause. But next week, I'm gonna show you guys a professional tourniquet, how it looks like and how it is done. So at least you guys can have, you can see how it is done to stop that bleeding. So do I have any other contribution, Sean, or any other question? Okay, so do I still have Mr. Sean? Okay, oh, he left. Tirus.
Yeah, I'm here, brother.
Oh, you're here. So do you have any contribution towards the airway breathing tourniquets?
No, I thought it was a solid lecture. I also enjoyed the story earlier about the personal experience about the tourniquet. I think that's one of the best ways to learn is firsthand stories of the people who experienced actually applying a tourniquet or having a tourniquet applied to them. And I remember hearing him say how painful the application of the tourniquet, how painful it was to have that applied to him. That's also very talked about. It's not very talked about as much, the painful aspect of application and knowing what that's doing for our patients, and addressing pain in the application of a tourniquet is also another thing to consider in treatment. But yeah, that was a great lecture. I have nothing more to add.
Outstanding. Thank you so much. So Tirus, the guy in charge of tourniquets. Tirus is not here. So Justin.
Hello. Yeah, go ahead.
Okay, Tirus, what is your contribution? Hey, can you find any tourniquets there? And we do a demo next week.
Yeah, actually, I was gonna talk about what lesson do you want to give next week?
Next week, we're going to do CPR, but I want us to do a tourniquet demonstration.
Yeah, I can find some few tourniquets, even if it's one or two.
Yeah. Okay.
Yeah,
I'm going to try to
I'm
keep
working
some on my side.
Yeah,
What's up?
yeah. I'm saying apologies. I'm still at work.
Okay.
That's why you can see me. You can see me walking about.
Okay.
Yes, yeah. So next week we can do that, and I've got someone for the CPR.
Okay.
Okay. CPR lesson.
All right. Cool. Hey, Justin.
Yeah.
Okay. Do you have any contribution?
No, you covered it, and that video did a good job demonstrating how to perform, especially for the infant, the back blows and the chest thrust.
Okay. Outstanding. Bailey. He went back to the gym. James Bailey.
I think the most important thing that I heard tonight, I mean, the personal stories are great. The presentation was good. But I think the most important thing I heard was doing the basic things well. You know, I've kind of always stressed, I mean, if you know how to do the basic things well, then you'll maybe you can do them well enough that you don't have to worry about the advanced things, you know, but you know, obviously in certain situations, I mean, you have to do advanced techniques and stuff like that, but do the basic things well. And most of the time, I mean, it'll work out.
Okay. Outstanding. Thanks much. Then there's a guy who has raised up his hand. Evans Ojode. Your hand is up. Ojode. Molala.
Good evening, everyone.
Yeah,
thank you for the lecture. It was really informative. We're so grateful. I have a question. Okay. I'm sorry, this is the first lecture I'm attending. So I wanted to know, because currently I hear that they're starting with C, then A, followed by B. So if you start with circulation first, you deal with the circulation first before you get to airway. So I wanted to know the rationale behind it.
Okay. All right. Thank you. Thank you for the question. Let me push that one to one of my guys, Sean.
Yeah, the idea behind CBA versus ABCs, as far as it being trained as of late, as far as your priorities, circulation, breathing, airway, in the event of somebody being in cardiopulmonary arrest where their heart stops bleeding, the idea was that during CPR, if somebody was to have a heart attack in the public setting, okay, they're out at a movie theater, they're at a park. If somebody has a heart attack, if somebody does CPR, that negative pressure on the chest, when they're pumping away on the chest, enough oxygen, enough air is going into the chest when you're coming up off the chest, when you're pushing down, you know, and the focus was on circulating that oxygen in the blood. That's pretty much the idea behind it. I don't know if that answers the question.
Okay, thank you.
All right. I don't think I answered it. Thank you, Sean. Mr. Evans Ojode, your hand is up. Ojode, is he here? His hand is still up. Okay. Does it, Ojode? Ojode? Evans? Okay, go ahead.
Hi.
Go ahead. And don't think he can hear us. Evans, I think he had a question. Okay, anybody else? Oh, Evans?
Yeah, Isaac.
Okay. Continue.
It's a muting and unmuting. Hi, Jack.
Yeah, hi.
This is Isaac. I think Evans is trying to mute and unmute himself. This is a good program. I thank everyone for invitation, and especially Tirus keep pushing me, but I've learned a lot today. I'm a first aider trained at work, but there are things today I picked from you, and I will say, Ogela man, you're doing very well.
Thanks,
I'll not miss another class. I'll be there. Okay then, thank you.
Okay. Thank you.
Hey, yeah. Jacob.
What's up?
Hey, Jacob, it's Sean. Yeah, sorry, I was asking myself again that question that was asked earlier about the CBA versus ABCs. Yeah, well, my understanding of that change in the priorities of ABCs was that people were afraid of the whole mouth-to-mouth CPR thing. They were afraid of communicable diseases and having to put their mouths on a stranger, and so it was causing a lot of people who witnessed cardiac arrest to not intervene. They were afraid of that CPR part. So the focus was just to do compressions on the chest, because enough negative pressure when you come up off the chest, enough air would go into the lungs to sustain life until advanced life support could show up and deliver to the heart. So CPR compressions is like the first priority over breathing.
Okay.
I don't know if that answers the question more accurately or not.
Yeah, Molala, are you still getting those answers?
Yes, I am.
Okay, so
thank you.
So now you understand the rationale behind the CAB?
Yes, do more compressions. Breathe when you can, but if you're not able to if you're not able to deliver ventilations or breathing, just focus on doing compressions on the chest and get help on the way. So they're just shifting more focus and priority on the compression aspect and not interrupting the compressions to focus on breathing. You know, because the focus is the heart has stopped. So you want to circulate blood as much as you can. So because there's so many interruptions, people stop doing CPR, they get distracted. So at the very least, if you can focus on anything, focus on doing compressions. That's the best we can ask anybody to do.
All right, thank you so much. So Ojode,
thank you.
You're welcome. Ojode, your hand is up.
Yes, Jake, how are you?
I'm good, how are you?
I'm good, brother, how are you doing?
I'm awesome.
Yeah, I would like first of all to thank you for this show. This program has been so much fun and very educative.
Yeah, you are coming. Okay, continue now.
And very educative. Eh? Yeah, what I would like you to do, you talked about when you have the obese, what can you do when you have the obese patient or pregnant patient and doing the helmix maneuver? I think we should come more clear about it and show people maybe some videos and how we can go about it with the obese patient or the pregnant patients to help when they are being choking. But about the pediatrics and the infants, the video was so educative and very helpful. And again, it's all about the basics. When you know the basics and how to do them well, it's all about basics and encourage and doing it at the correct time and part of chasing time, because it's about time to save a life.
Yeah, so your question is we need to clarify what we can do for obese or those big guys, chubby guys, right?
Yes, so you can show some videos for some how they can maneuver. For example, you have this a nurse that is very small, and the patient is the casualty is so obese or pregnant. Some videos can show the technique of how they can go about it. And it's also again about knowing the basics. The basics is key. Basics is key, and doing it at the right time and very fast will save life. But otherwise, Jake, this is a very great show. It's a good one, and actually keep it up. Shall be here, share with us the logins. We shall be attending this class. It's very important. Thank you very much.
Okay, outstanding. So I have a video here I'll show for pregnant women and for obese people. Yes, so let me share that video so at least you can understand better, okay? All right. For pregnant and obese people, well, how do you do abdominal thrusts? Yeah, so check this one out.
In the case of a pregnant woman or of an obese person, adjust your maneuver to position yourself at the level of the thorax, approximately in the middle of the thorax. If the person falls unconscious, ask someone close to you to call an ambulance and ask them to come back and confirm that the ambulance is on its way. Verify if the object can be visualized in the person's mouth, and if it cannot, continue to give compressions.
So, Mr. Ojoda, what you can do, you can, as we said, you can go through their armpits and then you go to their chest bone. If that cannot help, you can advise them. You can give them the instructions on what they can do by themselves. They can either lean by a table. Sorry, let me stop this one first. Yeah, so I was saying before disruption, you can go through the armpits, the axillary part, and then you go through the chest bone. And then if they're still bigger than you, then that's when you now delegate the instructions. You just tell him on her, hey, this is how you do, this is how you're gonna do your abdominal thrusts. You can lean on a table, you can grab a chair, and they can do it themselves. Okay, or then the last option, you can make them lie down, and then you do it from chest thrusts. You do the chest thrust when they're laying down on a hard flat surface. So you have all those three options to yourself. So did I answer your question? You are muted. Okay, you good?
Yeah, I'm good, brother.
Outstanding.
Thank you.
Jake, I don't know if you can hear me. Can you hear me?
Yes, I can hear you. I can hear you.
Thanks. Ni Frontown speaking. Thanks for a very good and very informative presentation, which I'm really pleased to be part of. I had an invite from Tirus as well, and I'm quite pleased I joined in. Something that one of the people asked, I think Morara asked about the C in CABC. I think your guys covered appropriately in terms of a medical situation. From a trauma perspective, which is where we have a significant loss of blood, the C primarily stands for catastrophic hemorrhage. Now, this is where, say for argument's sake, and I'll quote a specific example that I've seen in a traffic collision. Example in Kenya, a bus full of people crashes and people are bleeding from their limbs. Someone has just had a knee level amputation and your knee is bleeding. So that C stands for the catastrophic hemorrhage. You're not going to die because of the lack of oxygen. You're not going to die because of the accident. You're going to die because of the loss of blood. The circulation volume that you're going to lose, it doesn't matter how much CPR you're going to do. It doesn't matter how much airway you're going to manage. If you don't contain that blood, on average, a human being has at least 8 pints of blood. An artery can lose significant amount of blood within a very small amount of time. So to answer your question, Morara, when it comes to trauma, C stands for catastrophic hemorrhage. That equipment called a tourniquet. You can use a tourniquet. I like what Wanyoike was talking about, even a bandage or a handkerchief, a bandana. These are all the things that you can use to make a tourniquet, because you're going to strap away from the, say for argument, this is my elbow. I've had an amputation at the elbow point. You need to go above where the amputation is and put the tourniquet there. And as Jake said, you put it as tight as possible that there's no more blood coming from there. So that person survives. If statistics are right, they survive because of the control of the bleeding. So to answer your question, C, A, B, C, D, the C is for catastrophic hemorrhage when it comes to trauma. Thank you.
Thank you very much. That is very insightful.
Okay. Yeah.
Yeah,
See.
thank you.
All right. Somebody else, any contribution, any question?
Jex,
What's up?
There's a question from the chat from James Ngige. He's asking, how safe is it to perform mouth-to-mouth resuscitation in this COVID-19 era?
That's a good one. Okay. I won't advocate it, and I'm not for it. I myself, I usually have that sheath, the mouth mask for mouth to mouth, but I would say this, and I hope I have the leeway to say so. Me myself personally, and I'm not comfortable giving somebody else's mouth to mouth. But hey, if it's my immediate family, I'll do it by all means. So it is one of those things that I don't have a right answer for that, because that's what we call a rhetoric question. I don't know what I'll do until I'm in that shoe. If it's my immediate family, yes, I'll do mouth to mouth all day. If it's somebody in the streets, I don't know if I'm gonna put my cloth on it. I can put a cloth on it, just something that would make that air pass, but I won't let you die on my hands. I'll put a cloth, I'll put anything that I'll put a handkerchief, anything that can allow air to go through. But yeah, but there's those instances, I won't lie. And there are those instances that you'll be forced to give mouth to mouth, even if you like it or not. Because at the end of the day, if that guy or that lady loses their life, you're gonna be guilty for the rest of your life. So it's a rhetorical question. I don't know what I'll do if I encounter that guy in the streets and he's not my immediate family, and the only thing I can do to him is mouth to mouth. I might do it, but with the COVID-19, I'm very cautious, man. I'm very cautious, but yeah, it's tricky. So I don't have a long answer or right or long answer for that. I would say stay safe, but help where you can. Yeah, or anybody, does anybody else has a contribution towards that?
Yeah, I'd like to weigh in, Jake.
Yeah, okay. Will you give mouth to mouth?
For any person on the street, it would be difficult to really say. I think the words provider preference can dictate a lot here. You know, in this era with COVID-19, it's in the news, it's on everybody's mind, but also there's a lot more other communicable diseases that you shouldn't forget about either. You know, HIV, there's a lot out there. Also, just like any other intervention that medical providers perform, there's a risk versus benefit. You know, are you willing to put yourself at risk for the benefit of those few rescue breaths? Honestly, in that situation, worst case scenario, if they're already in respiratory distress, having a hard time breathing, or you know, they're not breathing at all, but they still have a pulse, that's why you're giving those rescue breaths, they're going to go into cardiac arrest. And like Sean was saying earlier, that negative pressure from doing those compressions, it's going to allow air to travel in. So in that case, just do the hands-only CPR, just doing compressions.
What if it's your baby or your wife? Will you do it?
Yeah, I mean,
you see, you see,
it works, it works.
You see, you see. Oh, so you're coming around. You're coming around it, and you're just coming to just say congratulations, Jakes, right?
That's right.
Oh, nice, man. So yeah, if it's family, I'll do it all day, all day. But if it's somebody I don't know, I'll have some reservations, or I can give you those rescue blades from a distance, at least 5 inches from your mouth. I can just be blowing that air to you, but I'm not touching your lips.
Through a garden hose or something.
Yeah, or I can put a cloth between me and you. I'll put a cloth, huh? Or a piece of anything, but we are not touching lips, man. Okay, James Bailey. Today you're gonna hate me, man. Tirus, James Bailey, will you give, there's a question about mouth to mouth. Will you give mouth to mouth?
I mean, I think me just being a healthcare provider, paramedic and all that stuff, I mean, obviously I know that, I mean, I have a buried device on my keychain. So, yeah. I mean, that's something I could use, I would use. I mean, I'm not worried about, some communicable diseases, but there are a lot out there that you do have to think about. So, I don't know. I mean, it's a judgment call at that point. I mean, do you want to, and it all depends on the scenario too. I mean, if I'm under a bridge and it's like, an alcoholic that's been there, I mean, do you want me to put my mouth on this guy that, potentially would have every disease in the book, or, inside of a mall, and this could potentially be a healthy person? I mean, there's a lot of decisions that have to be made, in the course of a few minutes. Will chest compressions alone sustain someone? Maybe to some degree, but there's a reason that they want us to do mouth to mouth as well. You can circulate blood all day long, but I mean, you do have to recharge the lungs to be able, I mean, with some pressure to be able to align the RBCs with O2. So I think it's a judgment call, but I mean, the easiest answer is, hey, just carry a barrier device on your keychain, if you can get one.
Yes.
All right. I hope that answered. I kind of moved around it a little bit, but I hope that answered the best I could.
Yes, it did, man. It did. Thanks.
Right. Thanks.
Gracias. Yeah. So this is how a mouth barrier looks like. So if everybody can see that, that's how it looks like, and you can get it for as cheap as I don't know if you can get it on Amazon. Let me see. Yeah, so it's very easy to put it in your purse, and they comes in bunches, and yeah, it's less than 50 cents. So that's like $50. Yes, $50 kind of shillings. So it's pretty cheap. So especially if you're in the healthcare field, at least you need it. Yeah, so like James Bailey said, me too, I usually have a couple, especially when I'm traveling, because you can encounter anything. So just have it with you. And so at least when you encounter that person who needs mouth to mouth, you can just put it on the mouth and just do your thing. So it looks like that. So if everybody can see it, that's mouth to mouth barrier. It's mouth to mouth mask. Right? Okay. Any other question? And not about mouth to mouth, obviously. So we call it a day?
Yeah, so just before we finish, I'd like to encourage the guys who are joining us to privately share with me their information. We are keeping a database of those who are attending our sessions. And it would be great to have their contact, what they do, where they're joining us from, just for future reference. Yeah.
Okay, outstanding. So get with my guy Gideon and give them his, give him his your details, so at least will be appearing on our database. Yeah, so we are collecting some statistics to see how many we training, how many people we trained, especially during this COVID-19. Yeah, so other than that, so I look forward to seeing each and every one of you next week. Next week gonna be CPR, and we're gonna be doing the tourniquet. We're gonna be showing you how tourniquet look like, how it works, and yes, and we move forward from there. CPR, then we're gonna go to circulation, and then we go to head, neck injuries, eye injuries, burns and fractures, and so forth and so forth. We're going to cover anything in the medical, anything in the medical, each and everything. So from my side, I'll say good night, and may God bless you and your family, and be safe out there, man.
Thank you, Jake. Thank you so much.
You're welcome.
Thank you.
Thank you so much.
Thank you. Thank you.
Thank you very much. Good night.
Yeah, hey, Wanyoike.
Yes, please.
Yeah, I would like you to be coming to many. That story need to be regurgitated. It need to be told each and every before each and every class. Yeah. So next week, please be here too.
I'll be available, but I'm going for surgery for an osteotomy on Monday. But yeah, I'll be available. I'll be available.
Yes, I'll see how I can download those pictures maybe on a CD, and I can be sharing as you talk, and I can be sharing them as you talk.
Kindly do.
Yes, okay. Yeah, thanks so much, man, and quick recovery, and all good luck in your surgery.
Cheers, brother.
Okay, when I come down there, when they open up the airspace, I'll come there to see you.
Make sure you do.
Okay.
Okay, yes.
All right, thanks so much, man.
Yes.
Okay.
Okay, bye, fellows. Good night.
Good night.
Good night. Right, yeah. That was lovely. Thank you very much.
Yeah, hit me on my private line.
Okay, not right now after this, or?
Yeah, right now I'm about to edit.
Okay, lovely.
Yeah.
Okay, yeah.